1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
We are a united community.
We may not be blood related,
but we Patriots are one big family.
Being part of the PWU community strengthens us.
Through the years, we support each other through good times and bad times.
We Patriots always have each other's back. It's a big honor to be part of a community that is open to the ideas of each other.
Drives us to excel and be the best version of ourselves.
That's the standard of excellence that we Patriots strive for.
I'm thankful that this community lets us be who we want to be.
We thrive because we accept each other for who we are.
And like a family, we treat each other equally.
Actually, PWU gave us a home and helped us to be a patriot in society.
We may have different individual drums and instruments,
but we march to the same beat together as one united community.
Do you want to march with our community of patriots?
I am a patriot.
I am a patriot.
I am a patriot. I am a patriot.
Breastfeeding protects the mother and child, and its health benefits are evidence-based and irrefutable. According to the World Health Organization, breastfeeding is and should be the normal way of providing young infants with the nutrients they need for optimal development. Virtually all mothers can do breastfeeding for as long as they have accurate information, utmost support from their family, the healthcare system, and even the society at large. Amidst the global crisis, with the present milieu of our country, and other possible circumstances that we might encounter, the Mother and Child Nurses Association of the Philippines, MCNAP, continue to serve as a luminaire, taking lead in achieving the breastfeeding best practices, women empowerment, and sustaining the gold standard. True enough, breastfeeding remains to be the clinical gold standard for infant feeding and nutrition, with breast milk uniquely tailored to meet the healthy needs of the growing baby. The breastfeeding best practices are key components to maternal and child quality and patient safety. Moreover, breastfeeding is a gift of life, an act of women empowerment that essentially lasts a lifetime.
First set is NP1 that will focus on CHN. Can you follow? Tama ba? CHN ba? Okay, NP2 is Umipedia. NP3 is MS, NP4 is MS, NP5 is Psychia. NP3, kung gusto magkumpiyansa mo. Okay, usually pag NP3, dalikod yung kuman. Okay? Here, your pencil, bold pen, read instruction, identify if it's set A or set B. Kinahanglan i-read ninyo kung ang sequence number is 0036, dapat ang NP2 0037, or na-sequence na pattern. Now remember this one, you need to relax, no? Kung lisod si NP1 ay kabalaka ng NP2. Kung lisod si NP2 ay kabalaka ng NP3. Kung nailisod si NP na NP4. Kung lisod si NP1 ay NP5. Kung lisod si NP5, pag-pray. So, will everybody back to morning there? Will everybody back to morning there? Everybody, congratulations!
You say all for the greater glory of God. It's all about reaching excellence, reaching integrity, and also, as much as possible, aiming for the top. So, if I were to be asked of any strategies when it comes to taking a board exam, it's just siguro I did 3, or it's very general. But first, it's really about knowing yourself. Because in knowing yourself, you will know how do you learn best, or how do you study best. So as much as possible, don't imitate others, like going to a coffee shop or a cafe just to study. You really need to know yourself. Where is your most comfortable place to study? Which books do you really want to study? Or maybe, what are your weaknesses? What are your strengths? Second, it's really about test-taking strategies and being a critical test taker. Because in the end, the PNLE is not really strictly concepts and theories. It's more on applications. It's more on how do you work, or how do you perform as a nurse. And last but not the least, it's really about relieving your anxiety. Because honestly, night before the board exam, I was still scanning a lot of books. That was, I guess, about hepatitis. It's not really more of a learning experience, but it's really more of relieving my anxiety. So do anything you can to relieve your anxiety. If you want to read book, if you want to munch of, or maybe eat a lot, so do it, because it can really help you on the day of the examination. I'm Philip Gabriel G. Himotea from Xavier University College of Nursing, top 2 of the June 2018 PNLE, Resident Review Specialist, Trust, Aim to Top Review and Training Center.
As we start, here are the webinar rules and guidelines. Number 1. The certificate will be sent to the attendee's email within 15 working days. Only those who registered and attended via the PWU official FB Live will be issued an ACE certificate. Number 2. Do not leave the webinar session without answering the evaluation form. A QR code will be flashed at the end of the webinar. The evaluation link will also be posted in the PWU official Facebook Live comment box. Failure to answer the evaluation form means no ACE certificate. Third, attendees' request for the evaluation form on the PWU official Facebook page and email after the webinar will not be entertained. So please, don't leave the session without answering the evaluation form. Fourth, PRC form and program ID will be attached to the certificates, which the attendee may apply for CPD units under the self-directed application. PRC will determine the number of corresponding units. When filing for the CPD units, visit PRC website prc.gov.ph, or you may send the forms to cpdd.applications@gmail.com. Fifth, registration is not allowed while webinar is ongoing. You can still learn with us via PWU official Facebook Live. When to follow up the ACE certificate? First, an attendee may follow up the ACE certificate if he or she did not receive it on a given period of distribution. The certificate will be sent to the attendee's email within 15 working days. Second, an attendee may follow up when he or she has answered the evaluation form. If a participant did not comply with its guidelines, the concern will not be entertained. Reason why an attendee may not receive the ACE certificate. First, the provided email in the evaluation form is invalid. Make sure that your email is active, free from typographical error, free from unnecessary character, and if an email is invalid, our messages to the recipients bounce back. Number 2, we also advise that an attendee will make sure that his or her inbox is not full. This may result in a bounced emails. Thus, an attendee will not receive any email from us. Third, the attendee did not answer the evaluation during the webinar. Please answer it before leaving the session. Welcome once again to the Philippine Women's University Graduate School of Nursing Nursing Webinar Series, Catching Up in Nursing Issues and Trends. As we start today's program, there will be an invocation to be Good day. We hope that everyone is safe and healthy. I will be your host for today, Maria Joancy Ocampo from the Philippine Women's University College Graduate School of Nursing in partnership with the Mother and Child Nurses Association of the Philippines Incorporated and AIM to Top Review and Training Center. Welcome once again to the Philippine Women's University Graduate School of Nursing Nursing Webinar Series, Catching Up in Nursing Issues and Trends. As we start today's program, there will be an invocation to be followed by the Philippine National Anthem, then the PWU hymn. We would like to welcome you to the third part of the Nursing Webinar Series, Catching Up in Nursing Issues and Trends, with 3 interesting topics and exciting games and prizes that awaits.
Let us bow our heads and place ourselves in silence for a prayer. We thank you for this day as we are all here to enrich and enhance ourselves in this webinar. May we ask for your blessing and divine providence that the activities set for this undertaking be successful and effective. We pray that you bless all the speakers for today, that they will deliver their topics well. May we also retain the invaluable knowledge and learning experiences that we will derive from this webinar. May we be living witnesses of your genuine love through the implementation of the knowledge that we will acquire. And grant us your divine wisdom as we go about our daily tasks after this webinar. Amen.
Sa simoy at sa langit mong bukaw, may dilagang tulad, awit sa paglayang minamahal. Ang kisap ng watawat mo'y tagumpay na nagdidinig. Ang bituin at araw niya kailan pa may di magdidinig. Lupa ng araw ng walhatit magsinta, may langit sa piling mo. Aming likha
At this juncture, to formally start the program, let us hear a welcoming from the current president of the Mother and Child Nurses Association of the Philippines, current President Eileen D. Ongleo.
Greetings of bliss and love from the Mother and Child Nurses Association of the Philippines, MCNAP. This is another opportunity to be infused with essential concepts and be able to translate these learnings toward quality practice in our respective areas of specialization. We are truly blessed to have all of this amidst the COVID-19 pandemic, and as such, I would like to congratulate the organizers of this virtual event, and I take this moment sharing with you a little on how to keep going and respond to the realm of the changing times. I want you to close your eyes for 5 seconds and maybe think of something that you have done as a midwife or as a nurse, or perhaps as a person in this very unpredictable world. We have a lot on our plate nowadays. Now, I want you to try to reflect on these words. What does it mean? Like, to do what nobody else will do, a way that nobody else can do, in spite of all that we go through. Keep pausing, and as you open your eyes, I suggest once in a while, think once again about these words. The pandemic truly added a layer of uncertainties to the, should we say, stressful environment we have been moving around. During these times, let me cite some words to encourage everyone here in bringing back this sparkling quadra, which I believe will be of great help in our daily grind. These are courage, confidence, competence, and compassion in whatever we do as healthcare professionals. I subscribe to the thought that self-reflection is a relevant aspect in this day and age, allowing ourselves to imbue anything that we do with this element of wise. Open-mindedness and keenness should always be there. Nurturing teamwork is a good habit. Experiential learning remains essential as we think. And spiritual core can help us with our individual introspections. Dear colleagues, let us keep moving and keep being productive. Do serve in every way and in your most special way. Thank you very much.
Our first moderator for this webinar graduated Bachelor of Science in Nursing in 2008 at University of Baguio. She was called to active duty in the Nurse Corps Armed Forces of the Philippines in 2013 up to present. She was assigned to the different military treatment facilities in Luzon, Visayas, and Mindanao. Currently, she is a clinical supervisor and the assistant chief nurse for training and education of Fort del Pilar Station Hospital, Philippine Military Academy. Without much ado, let us welcome First Lieutenant Remelin F. Inso, Nurse Corps.
Good morning to all the attendees of this webinar, and I'm very pleased to introduce to you our speaker for this morning. Our speaker is a graduate of Bachelor of Science in Nursing at Metropolitan Hospital College of Nursing, Santa Cruz, Manila in 2008. He also finished his Master's of Arts in Nursing at our very own university in 2020. Currently, he is the head of the Quality Improvement Department of Ambulatory Care Center, Hamad Medical Center, Doha, Qatar from November 2016 up to present. He was also designated in different nurse positions abroad, such as Infection Control Practitioner of the Communicable Disease Center, Hamad Medical Corporation, Doha, Qatar, Infection Control Coordinator of the King Abdullah University Science and Technology, and Infection Control Nurse at the Royal Commission Medical Center, Yanbu, Saudi Arabia. He also acquired numerous licenses and certifications, such as Certified in Infection Control, Certified Professional in Healthcare, Total Quality Management Professional. Without much ado, let us all welcome Sir Roderick Dayag.
Good day, everyone, and thank you for having me here. It's nice to be part of this program and to talk to fellow nurses about how can we practice and improve more in terms of quality improvement service, especially during these challenging times. You know, nurses are inevitably one of the backbone of healthcare system. Without you, delivery of care will falter. When we look at data compliance system, nurses are, if not one of the most, or if not most of the time, are the most compliant staff in healthcare system. You may want to look at hand hygiene data, you may want to look at isolation precautions or implementation of isolation precautions, and international patient safety goals, policies, and standards, you name it. This time, we want to give emphasis at how can we leverage quality improvement because we may need to look into our preparation, action, and experiences during the COVID-19 pandemic. Today, let's talk about challenges that have made us realize more during this pandemic. What is quality improvement during this time, and how can we implement quality and safety while considering health and safety of all healthcare workers. Right, and safety is our utmost priority. And when we talk about safety, we always connote this with quality improvement and how we provide safe place for patients during their hospital stay. During pandemic, as a healthcare worker, we want to work in an environment where programs are in place. Even in these challenging times, as nurses and clinicians, it is also our task to investigate the process, be proactive, and participate in the improvement processes and the systems of which organizations that we belong. Let's put aside a thought that quality is for those quality personnel and staff only. Let's embrace the fact that quality is about identifying gaps and is the responsibility of everyone. One of the key features of quality improvement is to understand what are the existing gaps. Understanding the gaps will enable us to give solutions and derive methods to make things easy with flow. We want to connect the gaps and find solutions to areas of improvement. The stark reality of COVID-19 pandemic challenged the very system established to ensure the healthcare safety and quality. How do we say that? The pandemic resurfaced long endemic challenges within the healthcare quality and standards ecosystem and identified novel challenges that cannot be ignored. There are four challenges that we have had. Number one, it interrupted cadence of quality and safety meeting. And number two, because this is a new disease, it requires new treatment, and therefore we are prone to errors. Number three, staff are redeployed or there are redeployment to unfamiliar roles, responsibilities, and locations. And number four, there are so many distractions during that time. Now, what are the preparations we have made during the pre-pandemic times, and have we implemented it? What are the risk mitigations for the risk areas that are known prior? What are the vulnerabilities in quality and standards exposed by COVID-19 and the opportunities to improve quality and safety response? Where are priorities changed? And what are the effects of COVID-19, both physical and psychological? Which gives rise to one of the questions I often hear. What happened to the standards that we have had before? Has quality improvement been used during the COVID-19 pandemic? The answer to that is yes. If you look at these pictures, these are all quality standard tools that are implemented. You have had your 5S. Social distancing is an example of 5S. You have your graphs, you have your checklist, the processes that are employed or used during these pandemics. We even have had the root cause analysis for these outbreaks or this pandemic. So these tools are all implemented during this time. We always say that quality is doing the right thing right at the first time, every time. And when we talk about the value of service, quality is always a part of it. We believe that the skill set of patient safety and quality improvement personnel is essential for the successful implementation of the changes required to achieve the desired outcomes. And yes, an understanding of systems theory and the complexity of healthcare systems, human factors and reliability theories, and change methodologies, all of this is key to the success of any transformation program. Let's look at the primary activities. A quality policy serves to clearly identify and define roles and responsibilities of all stakeholders in times of emergencies, including outbreak and pandemic. The clear definition of roles and responsibilities is particularly important in times of uncertainty, when emergency management needs to act quickly and synchronize efforts around a particular priority like COVID pandemic. Clearly, quality policy contributes to effective emergency management. Next, we want to look at the standards. These are sources of knowledge and activities requirements for service, processes and systems, for guidance on how to conduct activities, for description of best practices applied by experienced professionals in a given field, in this case, we, nurses, and for other specific information. Would you believe that during this pandemic, our hospital was able to get a gold certificate for an international accreditation? Yeah, that's true. And this is a real proof that despite this kind of emergency, we still, we still were able to achieve this momentous success when it comes to providing quality service to our patients. I will talk more about that later on. Next is the accurate process and outcome measures to assist in making. Decision making is very much in need, and staff commitments and compliance to standards and practices. This is an example of a process that helps an organization to deal with outbreak, such as during this time of pandemic. In this example, we clearly see how policies and standards are derived based on understanding the capacity of an organization, the management strategies that includes defining mitigations and measuring effectiveness, and analysis of applied measure. We used to test this method pre-pandemic, and to be honest, it had helped us a lot when the pandemic struck. It gave us a lot of lesson and learning to which we are going to mitigate, because that is what quality is all about, the ability to identify gaps that we need to work upon. As nurses, let's look at the patient safety and quality improvement skill that we can use during this pandemic. We believe that nurses must be equipped with the skill set of patient safety and quality improvement for the successful implementation of the changes required to achieve the desired outcomes. We want to strengthen the system and the environment, engage and empower the patients, improve clinical service while reducing harm, and boost and expand the learning system process. Let's take a look on how we strengthen the system and the environment. Carrying out the assessment allows quick identification of areas to improve as well as of solutions. although it is important for such assessment not to unduly simplify the complexities of readiness. Checklist is one among the example. It provides guide but not a complete solution. It allows us to investigate the system quickly. As nurses, we also must map it out. Look into the processes. Are there process that needs to be eliminated or changed to fit the ongoing issues related to the pandemic? I'll give you an example. The additional triage system that includes staff assessment before entry to the premises of the hospital has created a safety measure to prevent spread of COVID-19 among healthcare personnel. Next, know what is your common goal. It is also important to always look at the common goal of your unit, your team, or your hospital. Does your strategies align with the main aim? All actions must be in conformity with the organization's goal. Here, this is an example of a driver diagram. It maps out the change ideas or solutions to ongoing problems, referring to the primary aim and ultimately the main goal of the organization. It is very much applicable and is so true, particularly the need to embrace the concept of preparedness and healthcare system to be able to learn and refine how to respond to a health crisis. Um, for example, this COVID-19 pandemic. Number two, gather experience and evidence, filter, summarize, and brief. Because of the rapid evolution of information during these times, it is imperative to investigate scientific evidences. For an instance, the World Health Organization launched the COVID-19 Health Services Learning Hub. This is a platform that will use innovative approaches to collate, document, and synthesize emerging areas of learning on the maintenance of essential health services to support countries during the COVID-19 pandemic and beyond, including the recovery and post-pandemic phase. We also have information coming from CDC and all other international publications about the pandemic. But it is the responsibility of your organization to look into recommendations that fits your capacity and resources that is applied at the right time. What about communication? We all know that leadership is essential during a pandemic crisis at all levels. However, leaders are always at risk of missing feedback, lessons, and perceptions from the bedside. Help leaders with system thinking and learning through feedback loops, promoting deference to expertise and distributed leadership. Support and design frequent, concise, open communication about the ongoing situation and support situational awareness and situation monitoring about the pandemic and its impact, including effects on care of patients with conditions other than the pandemic illness. At the beginning of pandemic, very little is known about the disease, its specific behavior, the treatment, impact, and the evolution. Gathering experience requires access to an international network for which people are often uniquely placed through their international connections and affiliations with international societies offering web-based resources. As I mentioned earlier, those international bodies that provides ready information for use, we have the World Health Organization, we have CDC, among others, but experience from the frontliners like nurses like you are of the same importance. The reason is that you have the first-hand experience in dealing with patients. What do you think they need most on a holistic approach? These observations and findings must be studied, tested, and analyzed and implemented. We call it the bottom-up sharing of insights. And let's not forget about promoting staff safety. The prolonged pandemic has focused on preventing infection, but the interventions have had an impact on the mental health of the population. On reflection, the pandemic exposed an underlying issue in how we design our services and respond to crisis. We now need to design quality responses to the mental well-being of the populations. This means that our priorities must change and a holistic approach must be taken. Advise leaders on staff physical and psychological safety needs and on debriefing needs, including those for non-clinical staff. Set up a space for staff to express fears and preoccupations and relay this with appropriate confidentiality to our leaders. Next, how do we empower and engage our patients? With the help of patient partners, we advise leaders on how to maintain or develop person-centeredness. What about this? This is when we inspire caregivers to make patients true partners of their care, meeting their human needs and improving outcomes. For example, we personalize the kind of care we provide. We make sure that they have a clear comprehension and understanding of the services that they are about to receive. All this we do to improve the patient experience because we want to provide a holistic patient-centered care, looking at everything that touches the patient from their perspective and using the insight to influence not uh, the what of healthcare but the how. As an example, we want to improve the communication practices between patient and healthcare worker. The project is geared towards identifying several reasons in clinical communication barriers that affects effective interpersonal relationship, leading to inefficient healthcare. These barriers are systematically studied and delivered with mitigating actions to eliminate, if not decrease, the impact to patients and healthcare workers alike. Communication in a healthcare setting is one of the most important tool we have for providing great patient care and improving patient satisfaction. However, lines of communication can frequently be crossed, and this leads to lower patient satisfaction scores. The goal of this project is to build a trusting relationship between patient and healthcare staff through an established communication to provide or to improve patient experience and clinical care through patient involvement. Next is we want to improve our clinical care services. Now, nurses proactively participates in organizing patient and staff flows by promoting short briefs and huddles to summarize new guidelines, new tips for best practice, and information on the situation to support horizontal and vertical communications and help get all team members on the same page. We want to emphasize during debriefs, mutual support, and structured handoffs. Nurses also assist in the rapid discovery, review, and development of clinical decision supports that when we look at the processes, frontline staff offers a valuable contribution as they share real-time experience and solution. Let me share an example of how being a proactive staff creates a big impact. During this pandemic, I was approached by a housekeeping personnel that patients and staff are not compliant with waste management. So obviously, the challenge here is how can we make them follow proper waste segregation? Assessment was made and there is a big cost associated with this problem. Several interventions were made and it helped us in providing solutions to the problem. The project is still active and we were able to decrease the volume and cost of infectious waste generated to 95%. That is a whole lot of savings, and that is because the proactive observation of the housekeeping staff. What about reducing harm? As always, safety of our patient is our utmost priority. So we need to help the infection control team update guidelines and liaise with human factors and ergonomics and communication experts to help communicate and disseminate them throughout the organization. So we also have to perform just-in-time audits of key relevant standards and coordinate risk identification, analysis, and management of these risks. Also, we need to prevent pandemic-associated pressure injuries. We must boost and expand the learning system through strengthening the capacities of the learning systems our hospital provides. We also have to contribute to problem solving and solution generation, promote culture of safety, resilience, and learning throughout the organization, and support collaborative learning cycles at the frontline and harvest lessons from the experiences that we have, and contribute to data analysis and representation, and again, we need to harvest lesson from this. In leveraging quality improvement, we need to go back to the basics, and one must know where to start. To do that, we need to identify our aim. What are we trying to accomplish? In accomplishing this aim, we need to have measures. That includes your process measure, your outcome measure, or your balancing measure. And these measures are necessary for us to know if a change is an improvement. Now, it is also important to for us to have these change ideas, or what are the changes that we can implement for us to know if or what changes can we make that will result in an improvement. These change ideas needs to be tested using the PDSA cycle, or the Plan, Do, Study, Act cycle. In quality improvement, we should always nurses are expected to be proactive, and practices speak up skill. Sometimes a solution is just right in front of us. All it requires is looking through a different eye, and that eye is from us, nurses. Test your hypothesis and start small before moving to a larger scale. When we have something to share, make it specific, measurable, attainable, realistic, and time-bounded. And we do not work alone. Share it with a team. Two minds is always better than one. Do not be afraid to share your ideas, and make sure that it aligns to the common goal of the organization depending on what the situation requires, be it for quality of service staff and patient safety. Walk the walk. Let's do the things, or let's do things that we say we do. After all, attitude is a little thing that makes big difference. The quality of our thought determines the quality of our practice. And finally, for the key messages, quality improvement tools have been applied during the COVID-19 pandemic in a range of healthcare settings to standardize and improve processes, to measure change, and to test and implement intervention. An opportunity exists to build on the widespread change that has been led by healthcare staff at the point of care, and approaches to improvement offer valuable ways for dealing with complex problems, even in pressurized situations. Lastly, sustained success is likely to require commitment to the chosen improvement method, and for tools to be seen as part of the discipline of continuous improvement. Thank you very much, and thank you for giving me this opportunity. Please continue to identify your gaps and implement your quality improvement. Stay safe, everyone.
Thank you, Mr. Roderick Diet, for imparting us knowledge, updates, and your expertise as we deal with the COVID-19. And at this part of the program, we will have a live quiz. Reminder, as you register in the platform, write your full name, last name, and first name. We will be the one to reach out to you, but make sure to comment your name in the chat box once you win the live quiz. There will be 3 winners. Third place will receive 200 pesos. Second placer will receive 300 pesos. And for the first placer will receive 500 pesos. Prizes will be sent via GCash. So to all the participants, the QR code is flashed on your screen. Also, a link will be posted on the comment section for the live audience. Reminders, everyone is given 20 seconds to answer each question, and we will choose top 3 participants that was able to answer the 3 questions, that was able to answer 3 and the fastest to submit their answers. Participants, please do join the platform. Once again, it was flashed on the screen for the QR code. We will be starting in a few seconds, so please prepare your gadgets as we start the quiz. Reminders for our participants as you join the platform. This is for the first question. Ten seconds left. 5, 4, 3, 2, 1. And the correct answer is understanding the gap, wherein 32% of the participants got it correct. So for our next question, you have 10 seconds left. 5, 4, 3, 2, 1. And the correct answer is strengthen the system and the environment, wherein 57% of the participants got it correct. And for the last question, you have 10 seconds left to finalize your answer. 5, 4, 3, 2, 1. And 25% of the participants got it correct. Congratulations for the top 3 participants. Our second moderator is the July 2021 Philippine Nurse Licensure Examination Top 1, a National Review Center lecturer in Top Rank Review Academy, Aim to Top Review Academy, Southern Tagalog, Stars Lucena, Prime Review Centers, and others. Let us welcome Heidi S. Bacani, Nurse Midwife.
Blessed day and greetings, nurses and midwives. With great pride, honor, and love, I am here to introduce to you someone close to my heart, our guest of honor and speaker for the second session of this webinar. Born in India, she finished her general nursing and midwifery in 1997, licensed by Punjab Nurses Registration Council and Saudi Commission for Health Specialties. She also graduated from her post-basic BS nursing course and with her master's program in business administration in hospital and healthcare management from the International Institute of Management, India. She is currently practicing in Royal Commission Medical Center in Yanbu, KSA, as the supervisor in nursing practice, quality and professional development, where she was awarded for her JCI and Sibahi contribution, re-engineered their labor and delivery division, and co-chaired their nursing risk management committee. An instructor for BLS, BLSO, ALSO, an official trainer for Saudi Board Residency Program, trained triage, stable, QI tool, breastfeeding tool provider, and a national speaker in KSA. With her expertise and 25 years of practice, she will now share to us maternal nursing trends and innovations. Without further ado, please join me in welcoming our dear guest, Professor Khalida Bano.
Hi, good evening, ladies and gentlemen. I am Khalida from Saudi Arabia. I'm a regional supervisor of maternity and child, and I'm the instructor for also in KSA. Today we will discuss about improving and improvements and innovations in maternity and nursing, and the updates and trends. Being a midwife for 22 years in the KSA, it is something that this field, it's now running in my veins. This field is very interesting and so different than the other fields. Once you are in, you will see how we are dealing with they are not patients actually. We are not dealing with the patients. Our deal is with the healthy women, healthy females, and you will see that suddenly the person who is in the pain and has recovered and has the pain has relieved, and you will see the happiness with that infant. So this is something that it's not with the disease, it's not related to any pain. Yeah, of course pain in the sense not related to disease, not related to any illness. It's something that healthy female, healthy woman comes, and after everything is over, she is happy and she has the achievement and the infant in her hands. So let us see now what we are going to discuss about this. There are so many innovations, so many trends, so many things has gone advanced in this maternity nursing, midwifery nursing. We will only discuss some here. For me, this is the first time I'm using this recording video. It was very difficult for me to do so. It's Miss Heidi. She is the one who is giving me lessons every day, how to do, what to do. I really tried my best, but I failed. So I hope it will reach to you. I always like to do face to face, but you know, this is another innovation that we have to learn this one. Thank you. Just have patience if there is any mistake during this recording. Okay, now our outline, it will be introduction. We will have the innovations, trends in maternal and newborn nursing, health nursing. We'll see that new technologies. It's not, of course, it's not that much only. We have more than this. We are going beyond, but here at least we will have some ideas that where we are and where we can reach in future. Okay, at the end, reference and conclusion. Let's go part by part. Okay, innovations and trends in maternity and midwifery nursing is rapidly changing the world that require professionals to remain up to date in order to react to new or any development which will occur. So previously, as you know, midwifery was limited to a midwifery care, a basic midwifery care. What was the basic midwifery care? A woman will come with her pains, want to deliver. The doctors, the physicians will deliver her, and midwife will be the one to take care of rest, clearing her, cleaning her, doing the basic needs, but not some advanced practice. But now trend has changed. The midwives are now becoming advanced with this evidence-based practice by getting certificates in different advanced courses in the midwifery. So it has now, trend has changed. We are not now limited ourselves to the basic care of the delivery. For us, now the trend, now the care has gone advanced than what it was previously. High quality of care, evidence-based practice, as I told, is a key strategy for improving maternal and newborn. So it's very important for us, being nurses, it's very important always. It's not only in maternal field, it's all over. If you are not up to date, you are not having your evidence-based practice, up-to-date knowledge, you are not going to reach anywhere. So always you have to be your knowledge, your evidence-based practice, you have to keep on learning, keep on searching, keep on keeping your knowledge, keeping your evidence-based practice ongoing. Okay, now how we are going to improve the care, the nursing care, the midwifery care in females. First of all, if you are not qualified, once you are qualified and you will leave, you will just achieve the midwifery certificate and you will say, that's it. No, it's not going to work. You have to keep on seeing, you have to keep on improving yourself, you have to attend the courses, you have to, small example. When I did my nursing and midwifery, I never thought there will be something advanced courses in midwifery. There will be diplomas in midwifery. So I kept myself up to date. I attended the course BALSO, example, Basic Life Support in Obstetrics. There they gave us the basics. So once I saw I want to go for further, I want to go for more, I joined also Advanced Life Support in Obstetrics. They were saying, no, it's very hard, it's only for physicians. But I said, no, I have to go to it. I want to see, I want to learn. So I passed the also. After that, I said, no, I have to go further. I want to see more into it. I want to go deep into it. I started becoming instructor. I did exams and all, and I achieved my goal. And my knowledge is up to date in the midwifery. Always we have new trends, we have always new research which comes up, and we will keep ourselves with this knowledge and with keeping ourselves up to date. Excuse me. Standard of care. So it's very important. If you are following, if you are keeping yourself, your practice with evidence-based practice, you will be always having the standard in standard of care. You will have always, when you give care, it's with the standards. You will not do anything by your own. You will have you have guide, you have you have references to give your care. So always when you will be care, no one will be doubting your care. So the standard of care is always there with your evidence-based practice. Holistic approach. So your approach to the patient care, your approach to the care of the mother who is with you, how you will approach. It will be, your approach will be fixed to the guidelines, what is there to give to her, or it will be overall. You will see how you can achieve more, you can improve your holistic approach. You will improve by how? By doing the patient family centered care. This is the latest now. Patient family centered care has become trend nowadays. You are not only focusing on patient, you are involving all of them in the care. Evidence-based practice, as I said, you have to keep yourself always up to date with the knowledge, with the practices, with all the trends which is happening. And then we come with this research. Research should be ongoing. If you have any idea related to how to improve your area, don't keep quiet. Come out with the ideas, come out with the improvement, innovation ideas, work on it. If it will not work, no problem, but you came out. If it will work, it will make change in the field. Okay, the goal to achieve, why we are here, we are talking about this innovations, updates, upgrades, improvements. For what? What is our goal? Why we want to do it actually? Everything is going fine, but what is in our mind that we are talking about innovations, we are talking about new trends, new improvements in the maternal nursing. What is the goal actually? Our goal, first thing, to reduce the rate of maternal mortality, right? Second, reduce the rate of fetal and infant death. So if we achieve these two things by our practices, by our innovations, it is something that really a big achievement. Reduce preterm births, reduce cesarean births among low-risk women. That has become trend nowadays. Improving the well-being of mother and infant. Okay, to reduce the rate of maternal mortality, how? With what? If you are not giving a better care, if you are not keeping yourself updated with the knowledge, with the evidence-based practices, you will miss something that will really lead us to maternal mortality. There are some trends like WHO NIRMIS approach, maternal waiting home, doulas, virtual antenatal care, patient education, antenatal classes, all are adding to the reduction in the maternal mortality. Somehow it is all approaching to the reduction of maternal mortality. Is it working or no? Yes, it is working. The knowledge, the mothers are getting their knowledge up to date. They know if there is any emergency signal, any emergency signs, they will see. They know because you are the one who is giving them this education. This is during the care, antenatal, and during the intrapartum, during the delivery time. Postnatally, postpartum, our biggest problem, biggest mortality is happening by bleeding, post-delivery bleeding, PPH. So if we will have if we can detect early the PPH, if we can manage the PPH very early, we will not let the mother suffer. We will not reach to the mortality rate. We will not reach to some disaster. So there are so many trends nowadays. There is so many innovations that there are really innovations that there are now. What we will say we are using those innovations, and it's really working. And we have seen it by ourselves that how it is working during these emergency situations. Bakri balloon is there. We'll just discuss in further slides. Early intervention in emergency. So these are all early intervention nowadays. They are planning to have the codes in maternity and delivery sites, like labor and delivery. If there is any emergency, if we will have a team which will be called in the same time, we will save the time. If we save the time during the emergency in delivery room, it can prevent us from reaching to the maternal mortality. Go to the next. Another, as I told you, the WHO NIRMIS approach. I will tell you what is it. Maternal waiting home, postpartum butterfly, transvaginal Bakri balloon replacement, and the BLS basic life support, which as there is AED, defib, early defib, there is Lucas external cardiac compression. You don't need to do the compression. If you have it in hand, you can use that external cardiac compressor Lucas. You don't need two men. The Lucas machine itself will give the compression, and you are there managing. And the defib, early defib will always increase the survival rate in the victim. Okay, purpose of NIRMIS approach. Now we will just talk about the NIRMIS approach. What it is, why it is there. To improve the clinical practice and reduce preventable morbidity and mortality through the use of best evidence-based practice. Used to monitor and evaluating quality of obstetric care, decrease maternal death and improve maternal health. Okay, this is the approach. Maternal waiting home, the next one. Maternity waiting home is offer a low cost way to bring women closer to needed care obstetric approach, because sometimes in some areas, if you cannot afford a better care, you cannot afford the hospital care, you cannot afford the antenatal care, you will not go to the hospital. So during this time, surely we will miss the things that were need in attention. So this maternity waiting homes is a low cost areas that where they will keep the females to reduce barrier for accessing the facility birth, skilled birth attendants. Go to the hospital during the labor and delivery or in pregnancy if complication occurs. So what they will do, if they will find during the antenatal care, if they will find, okay, this female, this woman is at risk of very low risk with they will keep in the waiting home, and when she is in need, they will bring her to delivery room. So if she is not going to have even to pay for a big amount for these things. So 3, delay in seeking appropriate medical help, delay in, so this is the criteria actually, criteria who are supposed to be in this maternity waiting homes. So there are like 3 delays. The mother, she didn't come for 3 visits. Suppose she is already in her 6-month pregnancy. Delay in seeking appropriate medical help. Delay in reaching an appropriate facility. Delay in receiving adequate care. So this is the criteria here, like parity from 0 or more than 6. So if you are nullipara, you are the one who having the eligibility to be in that home, or if you are multi-gravida, you are gravida more than gravida 6, you are eligible. History of previous perinatal death. If she has any previous history, perinatal death, she is a candidate to be there. History of operative or complicated delivery, so previous cesareans or previous any complication during the previous delivery. Height less than 150 centimeter, hypertension, diabetes and anemia, hydramnios, preeclampsia, toxemia, non-cephalic presentation, so it can be any breech or transverse, multiple pregnancies. So these are the criteria that the woman is eligible or should be in the maternal waiting homes. So services, what are the health services there in these areas? Health services, pre and postnatal care. So physical exams, lab tests, 24 hours nursing care. So there is 24 hours care that they are needed, there is available there. Treatment of any illness, if there is anything that is needed during this time, is available. Uncomplicated deliveries. They can even deliver if the deliveries are uncomplicated, because the maternity waiting homes are near to the facility, near to the hospital. So it's not that they have to be far and then if something happened then they have to rush and run. No, it is the waiting home but chosen near to the hospital, near to the health center, but it's not the hospital. So what are other things they are providing in these areas? Childbirth classes. That is very important, that we are lacking in so many areas, that our childbirth classes are not active. So here they continue the childbirth classes. Newborn care, which is very important when you are teaching mothers how to take care of the newborn. Breastfeeding, very essential. Nutrition, family planning, skills training. Other services, food and laundry, recreational activities. So when they are there, they are not sitting in the bed, they are always letting them move around, or recreational exercise and all. Child care, ambulance services there, and incoming. Okay, now we will talk about the postpartum hemorrhage, the innovations, how it really help us in preventing. The highest cause of maternity mortality and morbidity is postpartum hemorrhage. If we will have early intervention of preventing postpartum hemorrhage, we can have reduction in maternal mortality and morbidity. Here, the postpartum hemorrhage, managing a postpartum hemorrhage, doing everything by manual, giving the early medications, Sindosunan and others. The butterfly is like a bimanual compression, as all of you who know that bimanual compression is given if there is postpartum hemorrhage, with one hand on top doing the massage, and another hand is inserted the posterior part of the uterus. So both will be given the massage. So this butterfly is a device which will be inserted, and it will prevent the postpartum hemorrhage, and at the same time it will help us in diagnosing the further. If the bleeding is not stopped, that means there is something with the underlying cause, and if it is stopped and that they have laceration, they will treat it accordingly. And it's a single device. It's very easy accessible, but still it's not used in so many places. I have not yet used it by myself. Second one is Bakri balloon. Bakri balloon is latest trend now. It's now ongoing. Here in some hospitals start already using, and I have used it, and we are even teaching it in our class about the Bakri balloon, of how to use it, the procedure and all. It's also a novel device designed to treat PPH through uterine compressions. It's less invasive and less tiring than traditional bimanual compression. So with the bimanual compression, you have one hand in and one on top. You are trying to do the manual, you are getting tired. With this one, if there is postpartum hemorrhage, it's like catheter, it will be inserted, and 500 cc of saline will be inserted. It will become a balloon. Once the balloon is made, this balloon also will compress the sides of the uterus, and it will help us in stop the bleeding. Okay, number 2, reduce the rate of fetal, infant and death. So how the innovation is helping us in reducing the rate, the fetal and infant death. Fetal monitoring wireless using smartphones. Like previously, you have to come and see any physician who has the patient will come and see the fetal heart, see the CTG ongoing, then decide upon it. But now with this wireless smartphone, the CTG will be ongoing, and the phones and the screens, wherever the physician, even he is at home, even he is in the clinic, in wherever he will see his the patient's fetal heart racing by the phone and take decisions. So it's early intervention which is helping us reducing fetal heart, reducing the fetal and infant death. Non-invasive perinatal testing, self-free DNA screening, where we are detecting the chromosomal issues and problems, vaginal seeding, and continuous education and training trends. Okay, again we will see now third, to reduce preterm births. As we say, how it is helping our innovations, how it's helping to reduce the preterm births. Like previously, if there is preterm labor, they have nothing to help the mother. They have nothing. She will be in the hospital. At the end, she will have the preterm birth, and it will be disaster. But now trends, new innovations had really come, which is really helping the preterm births, which is helping the preterm, if they are in preterm labor, it's helping them to continue their pregnancy, so that at least they can reach to the they cannot be in to the they cannot deliver them by preterm, and then they can just still have more weeks so that they can survive. Like maternal progesterone supplement during this time, if they have any previous history, they have any chances of having preterm, the progesterone supplement is given to the mother throughout to reduce the preterm birth chances. Cerclage is also very important, that we are nowadays using it very regularly, I have seen, and it has really helped the mothers. They will cerclage the cervix, they will keep it sutured until the mother will reach, like it's like a suture, they close the area so that it will not start opening, it will not, until that mother will reach to term, then they will remove the suture for her to have a normal labor. Treatment of intrauterine infection. So why treatment of intrauterine infection? Always, if there is, even we will talk about example UTI, urinary tract infection. If the infection is not treated, mother will lead to the preterm labor. She can deliver the preterm. So infections or intrauterine infections, and they are very important to treat. So once you treat it in early, you can help the mother to reduce the preterm birth. Prevent exposure to cigarette smoking, which is very important, that how we will prevent it by education, by giving the patient family education. We will educate them how the smoking affects and how it can lead us to preterm birth. Improvement of maternal nutrition, very important. This also can be, that's why I said from the before, like the education is very important in this. If we can really work on this, as I said before, we can save all these things, we can improve all these things, nutrition, smoking, antenatal care, all will be improved through the education. Lifestyle modification, again with the education, lifestyle modification to ameliorate maternal stress. So you can, sometimes the mothers who are under stress with the pregnancy, this all because of the hormones, because all her body shape has changed, her things what she was doing before, she has now limitations to the things, and it leads for her a mental stress. So if someone is there who educates her, who gives her continuous education about this, she will not reach to something stress during the pregnancy, after the pregnancy, which can lead her even to the depression and postpartum psychosis. So WHO approach to reduce also this preterm births. Omega fatty acid, omega-3, they always give omega-3. So research, it has confirmed the omega-3 diet, pregnancy women have a positive effect on visual and cognitive development of the baby. Study have also shown that higher consumption of omega-3 may reduce the risk of allergies in infants. Okay. So as I said, fetal monitoring wireless using smartphones, continuous monitoring, wearable devices, it's like this, continuous fetal monitoring and intermittent monitoring wireless, it can be seen through the mobile. Non-invasive prenatal testing, as we say, this is cell-free DNA genetic screening. It's a new genetic test that uses the cell-free circulating fetal DNA in the maternal serum to screen for the more common inequalities like other chromosomal problems, trisomy 21, Down syndrome, Edward, and all this, they can detect it early. Okay, vaginal seeding or vaginal microbe. This vaginal seeding is a procedure whereby vaginal fluid vaginal microbe are applied to a newborn child delivery by cesarean. The increase in the rate of cesarean delivery, increase in the frequency of ectopic disease. Actually, this vaginal seeding is done to protect the child from the diseases like asthma, obesity, diabetes, and others. But still, it's under clinical trials. It's not recommended by the medical facilities. Still under the trials. There is not much data about it, but it's one of the innovations that can be in the future use. Okay, to reduce cesarean section birth, improved and standardized fetal heart rate interpretation and management also may have an effect. We say how. The thing is that if the fetal heart is not interpreted correctly during the CTG, during the tracing, the management will be wrong. So it's very important for all midwives, doctors who are working that to have a high knowledge about the interpretation of the fetal heart. So if it is done correctly, the management will be also good. And also increasing women's access to non-medical intervention. So if you are teaching the woman non-medical intervention during labor, like exercise during the deep breathing exercise, other non-pharmacology, like we have doulas. Doula is an individual who stays with a woman during her labor, comforts her, massages her, support her, talking to her. So it has shown that there is a reduction in the cesarean by these doulas. So this is the support during the labor. WHO cesarean section rates are close up to 15%. So nowadays it has become a trend that woman cannot tolerate the pain, ask for cesarean, and it is done. So this is not a normal thing. It has to be. We have to come over with this one. WHO Robinson classification. It is a system where they are classifying the group of women in 10 group based on their obstetrical histories. Like these are the criteria. Parity, they will see the parity. They will see the previous history, like what she has in the previous pregnancies, gestational age, onset of labor, fetal presentation, and the number of fetus. So the cesarean section decision will be depending on these categories. Okay, they are classified. New technology in maternity and newborn health nursing. You have seen nowadays robotic surgeries, gynecological surgeries, with the heat during labor, virtual to relieve the pain, massaging bra, clever digital pregnancy test, MyPeri10 devices, contraceptive chips, and more and more are there to discuss about. But these are some few that came in the view to discuss about it. One of the innovations here, robotic gynecological surgery. It is one of the latest innovations actually which has a minimal invasive surgical techniques. It's well structured. The nurses also are there, robotic nurses who are trained by a good structured training program, and it is used nowadays in hysterectomy, tubal ligations, removal of fibroid tumors, cancers, ovarian cyst, infertility surgeries, endometriosis, genital prolapse surgeries, and others, so on. Okay, now let's move to the robotic nurse, which plays an essential role in successful robotic nursing. As a part of the robotic surgical team, each one of the robotic nurse team, nurse coordinator, nurse scrub, scrub nurse, circulating nurse, has a certain job description to ensure maximum patient safety and robotic surgical efficiency. Actually, robotic nursing is a well-structured program where they get trained, and with this training they are becoming confident and to maintain the high quality care during the surgery, robotic surgery. Okay, let's go to the innovation during the labor. The Vita heat during the labor. Previously in so many delivery rooms there will be cabinets which will be warm, which is electrical cabinets where the linens will be kept, and during the time of delivery when the woman is getting cold, you will give the warm blanket, but it gets cold very quickly. So the innovation changed the system. So what happened with this portable heat, it moves, it has wheels, so it moves during the whole time when the woman is in the labor or when she needs it. It will be there, it will not get cold. The heat is continuously, which really helps the woman in relieving the pain and being stable during this time. Okay, and now pain management. We go to the pain management. What is our innovation during the pain management during the labor? Here you can see the CTG is having regular contraction. That means she is in active labor. And with this active labor, with this pain, instead of screaming, she is busy in watching what, which is keeping her mind diverted towards this virtual video, and she forgets her pain. So this is really a good innovation. I feel like this is a good thing that to work on, and to have in the future to work on this pain management during the labor, which can reduce the cesarean section, which can reduce the exhaustion of the patient, mothers. They will be in peaceful way delivering. So this is really something that should be worked on. So here with this virtual thing, the pain is diverted, so she is not having a feeling of the pain as it is without that one. So this is really a good innovation for the maternal and child labor process. Here, as you see, same thing as we show the previous picture. It has women participating in the research who used a VR headset for a portion of their labor, reported as statistically significant. So there is research about it, how much the pain is reduced with this one. This is the study done by Plateau 2017 to determine the effect of virtual reality using a smartphone on pain reduction in premature women during labor process. They concluded that virtual reality is an effective complementary non-pharmacological method to reduce pain during labor. Okay, Clear Blue. Clear Blue is the first one-step test where the pregnancy can be detected, the hormone can be detected early before someone missed her periods. In this, even 5 or 4 days before the periods are missed, you can check the pregnancy by this, and 99% of this is accurate. It gives two ways to check the pregnancy. So this is also a one innovation that you don't have to wait for missing the periods. Of course, sometimes it cannot be 100%. Sometimes the 1% will be there. So, but overall the accuracy is 99%. Chip, contraceptive chip. So many of us, I am having one. The contraceptive chip is very affordable and it's very easy, and you don't have to be thinking of taking tablets. You don't have to be thinking of putting tampon monthly. You are putting the chip and you forget about your pregnancy. It's very good innovation that actually it is a chip which is implanted under the woman's skin, releasing small dose of levonorgestrel daily. It's very safe, very effective, and for long time birth control. Let's talk about something about telemedicine and pregnancy care. You can see here pregnant woman with this approach. She is having connection to all. Again, I'm saying about the education. It all depends. She is having her parental care. She is having her lactational support, virtual postpartum visits, at home monitoring, weight, everything is there. So it has been easy. It is becoming easy now more and more that a female, she don't have to move from her home. She don't have to go out. She can be at home and she can get all the informations what is needed for her. And now here, even we deliver the medication to the home. It will be there. The medication will be taken from pharmacy, and we will send this medication to the home. So as this telecommunication for day-to-day during high-risk pregnancy tests and steps, including electronic medical consultations, reviewing, making recommendations. If like she is having any high risk, they will recommend to come, or they will visit to her home. Other counseling, genetic counseling for any risk factor, if there is previous history of any problems. Video conferencing, the doctor and patient can also discuss during the ultrasound face-to-face or over video. Virtual rounding, being at an inpatient beside, because actually the pandemic has really made the innovation more faster than before. During this pandemic, we have seen that the patients were not coming. We were just using the teleconference, talking to the patient, giving the care, or seeing them through virtually when they were not in need to come to the hospital. Like same in the pregnancy, when you have a low risk pregnancy, there is a system that one visit will be virtual by telecommunication, and one will be by present. You have to come to the hospital by person to person. So it's like that, one and one until she reaches to the term. But if there's any, during this time, if there is any complication, if there is any risk factor, it's recorded, it's noticed, but this is the way of doing one and one, like one visit, one virtual, one visit, one offline, like that. So as nurses who deliver, manage and coordinate care and services using telecommunication technology are determined to be providing telenursing. Telenursing may occur. This is something to go if you want to go for further, want to be in the future, more excitement with this telemedicine, you can go for it. This is like the telenursing may occur via interactive video discussions, as I told you before how it works. Here is like the example. She is at home enjoying with the pregnancy and everything. This is her, or she can see everything through her mobile. So she is not being ignored. She is not being unaware of anything. So with this same thing, she will get daily education and information. So in conclusion, it's important for maternity nurses to recognize that new technology help to improve maternal and newborn health, building skills. Continuous training is very important to improve maternal health and improve quality of care. Okay, looking forward, despite of low utilization right now at this time, there are many ways of telemedicine which can be integrated into perinatal and postnatal care, infant care. These technologies are particularly useful in addressing the urban and rural, where the care is not much yet, but it can really help us for them to reach the specialty to them, or to have the care, or by this way. And half of the people, like in the federal, actually is supporting and using the telemedicine service for maternity care, which is really existing. But the expansion of these services will likely depend on the decisions regarding insurance, money, all other things in the future. So I think this is it. These are the references. Thank you. This is my place where I belong. This is Kashmir, full of snow. Thank you. Any questions?
Thank you so much, Professor Khalida, for that very interesting topic. I hope everyone was able to grasp all the information shared to us by our speaker. And with that, we will have another live quiz. Again, the person who answers the question correctly will receive exciting prizes from our sponsors. And again, as you register, write your full name, last name first, followed by your first name.
Are you ready for another live quiz? The QR code is already posted on your screen, and also a link will be posted at the comment section for our live viewers. 20 seconds is given to answer each question. A leaderboard will be flashed at the end for the top 3 winners who answers correct and fastest to submit their answer. Reminder, as you join, please use your full name, and we will be starting in a few seconds. Once again, for the top 3 winners, for the third placer, you will get 200 pesos. For the second placer, you will get 300 pesos. And for the first placer, you will get 500 pesos via GCash. Reminders, the top 3 winners who got the correct answer in the fastest to submit will be on the top 3. The first question. So please key in your answers. And you have around 10 seconds. 5, 4, 3, 2, 1. Time's up. And the answer is all of the above. 80% of the participants got it right. So for the second question, you have 4 options for this one. Please key in your answer, and you have 10 seconds left. 5, 4, 3, 2, 1. Time's up. And 27% of the participants got it right. And the third question, you have 3 options for this one. Please key in your answer. You have 10 seconds left. 5, 4, 3, 2, 1. Time's up. And the correct answer is letter B, wherein 43% of the participants got it right. So congratulations for our winners. The top 3 winners. Thank you, everyone. For our last and third moderator, to our winners, please do comment on the comment section for the PWU FB Live.
For our last and third moderator, he is a graduate of Bachelor of Science in Nursing in 2010 at Emilio Aguinaldo College and is currently pursuing his master's degree in nursing at the Philippine Women's University. He pursued his career in the BPO industry in 2012. He then gained his hospital experience as a staff nurse at the Medical Center Parañaque for 3 years in 2015. Moving forward, he went back to the BPO and became the Quality Assurance Manager and currently the Operations Manager of Telco Services Australia. Without much ado, let us welcome Mr. Gail Fernan Galang.
Greetings of health and prosperity, ladies and gentlemen. Today, it is my pleasure and honor to have this great opportunity to introduce to you our third speaker. Our guest of honor is keen on business continuity management system and positive psychology. His educational attainments are Bachelor of Science in Nursing at Pamantasan ng Lungsod ng Maynila, Master of Arts in Nursing at St. Paul University, Manila, Master in Development Management at Asian Institute of Management, Doctor of Nursing Science at St. Paul Tuguegarao, Diploma in Computer Science at the University of the Philippines Los Baños Open University, Master of Information Security at De La Salle University, Manila. And so without any further ado, please welcome Dr. John Francis Fausturilla.
Hi everyone! Today, I'll be talking to you about nursing informatics in the era of physical distancing. And we will understand more nursing informatics competencies, roles, and directions in the Philippine setting. Some disclosures about myself. I am John Fausturilla, a lecturer 2 at the Medical Informatics Unit under the College of Medicine at the University of the Philippines, Manila, a professorial lecturer 3 for the Center of Nursing under the College of Allied Health Studies at the University of Makati, and a freelance ISO auditor for TUV Rhineland Philippines Incorporated. At the end of this presentation, we will be able to appreciate where the nursing profession stands during the digital and COVID economy, be familiar with the competency sets fundamental for the Philippine Qualifications Framework Level 6, and explore opportunities and directions of nursing informatics practice in the Philippine setting. Before that, I would like you to watch a video clip for you to better see the vision of where probably nursing stands in the Fourth Industrial Revolution.
彼女は看護師ヒューマギア、白衣の天使ましろちゃん。天使の笑顔だ。顔認識によって患者の身体情報や病歴を検索。ヒデン・アルトさん、22歳、身長176センチ。体重62キロ、血圧115の74。看護技術のすべてを迅速かつ正確に行う看護のエキスパートです。それでは息を大きく吸って。
ねえイズ、ちなみに俺の個人情報外部からハッキングされて流出したりしないよね。
ご安心ください。医療ヒューマギアはセキュリティの関係で病院独自のローカルネットワークによってデータセンターで管理されています。
看護師ハッキング。なぜ失敗？
ああ、終わった。
定期健康診断お疲れ様でした、アルト社長。
お疲れさん。しかしどこ見渡してもヒューマギアだらけだな。
そもそもヒューマギア開発の発端は人工知能を医療に役立てることが一番の目的だったのです。
咳なんか出ます？
お見事先生。 病院で運用されているヒューマギアの数がどこよりも多いのがその証拠です。
人工知能が人の命を救う。すっごい時代だな。
So here, we can see that we are actually moving towards a bright future and a very interesting one at that. So, do you think that in the digital era, we will actually be overrun by robots and by artificial intelligence? Would Humagears be actually taking the role of nurses, physicians, and other healthcare professionals for that matter? How possible is that future that you actually saw just a while ago? We'll try to see where we will be going into that in the next few slides. But for now, let's talk about where we are right now and what actually basically is the rise of the digital economy. So we have known already that we have had many industrial revolutions, and we have started some 10,000 years ago with regards to the agrarian revolution, and came through the steam power, railways, and mechanized forms of production. And here we are with a lot of electricity and approaches to manufacturing in the second industrial revolution. Hence, in the third industrial revolution, semiconductors and the spread of computers and what we use right now in terms of internet is proliferately known in the third industrial revolution. And here in the fourth industrial revolution, we are starting to have breakthroughs in terms of digital, physical, and biological realm. And we have seen the characteristics of the fourth industrial revolution having unprecedented breadth and depth of the speed of change. So we are not just having very complex innovations in terms of what we have right now, but also very speed at that. And we have seen this with how we actually responded to the pandemic, the speed of the creation of the vaccines, where probably in the previous industrial revolutions would not be possible. And therefore, there are a lot of driving innovations in healthcare and in health. And here we see the digitalization of health and healthcare, unsustainable rise of costs, and rapid evolution of science and medicine, altogether being a cyclical change that we are seeing in the fourth industrial revolution. There are also many tools I would like to share with you, and one of that would be the hype cycle. And this is one produced by Gartner in order for you to appreciate better a lot of the things happening right now. And you have probably heard about non-fungible tokens or NFTs, the use of AI, quantum mechanics, quantum machine learning, augmented realities, and other applications of AI. And for this, you have actually seen that over the years, emerging technologies stay on top with regards to the top hype cycles that people look into. And artificial intelligence follows through. Now we're seeing a lot of rise in terms of security, and information security is one of that would need to be important for you to look into. And we will cover a lot of this in a while. Also, widely used innovation profiles include that of Emotion AI. The 5G use in terms of healthcare is also there. And chatbots have been proliferate during these times where we are in lockdowns and probably will stay and will be used by many companies in terms of various points of application. We have also seen fast-moving innovation profiles, including that of the contact tracing apps, simply because there was a demand for us to look into this, and data classification. There is also patient self-scheduling, and a lot of things happening, and very exciting days for Wi-Fi 6. However, we have seen stagnation in terms of the current nursing pathways and how it is actually being defined, especially in the Southeast Asian region and in the Philippines for that matter. We are still stuck with the traditional roles that we have had for many decades now, and while there is actually a lot of movements with the non-conventional and non-traditional paths, we are still yet to define them in the Philippine setting. There are actually a lot of data that are being generated, and medical at that, and this is something that we have to be aware of. The new oil is now data. A lot of companies are earning from data analytics and understanding the profiles and behavior of not only consumers, but patients altogether. We have also seen regulatory changes, including that of the implementation of telemedicine in various areas because of the lockdowns, and we have adopted a lot of things happening right now in terms of the space of digital consultation. Likewise, there are regulatory updates as to how we would have a comprehensive nursing law, and there's actually an insert, and hopefully this is something that gets passed into a law, where specialty practice nursing is already clearly defined under this bill, including also advanced practice nursing. And this is an opportunity for us to define what we do right now into a vividly clear specialty practice. Hence, we have to understand that we are still in a disconnected and fragmented system framework. There is still no legal anchorage in the practice of nursing informatics specialization, at least as we speak right now, and a highly changing landscape outdating textbook information and definitions of practice of nursing in the digital and COVID economy. Hence, what do we need to know? We have to first understand, of course, that artificial intelligence is here already and here to stay. And there are actually publications stating that at some point in time, artificial intelligence will overrun human intelligence. Hence, the video that you saw a while ago. But does it mean we have to be threatened? Does this mean that nurses will be replaced at some point? Or do we coexist with these technologies? Let's have some examples of how these innovations actually stay at now with the Philippine setting. In terms of digital health, we have also some of the assessment, diagnosing, planning, intervention, and evaluation space being automated at the moment, or digitized for that matter. One of the leading healthcare management organization providers here in the Philippines, MaxiCare, has already launched its health pods, and it is basically utilized by their members for electronic consultation. So as you can see in the image, they actually have it here where they are able to just sit down, put their arms in the machines, and all of the information that is being gathered here are digitally transmitted to the primary physician who will be taking care of this patient who is actually consulting. So here we're seeing exciting times. But now lies the question, where do nurses take their roles in terms of the traditional vital signs taking? Because as you can see, there's actually no need for a nurse to do that manually already. Likewise, for oncology, let's watch this video.
Stanford University.
There's a global shortage of radiologists. According to the World Health Organization, 2/3 of the planet's population, over 4 billion people, have insufficient access to radiology services. AI can help that.
We developed a deep learning algorithm, which we call ChexNext, to interpret chest X-ray images.
That can take as input any chest X-ray image and tell you in this image what are the diseases that are present and what is my algorithm's predicted probability for each of those diseases.
Some examples are mass and nodule, which are cancerous, cardiomegaly, enlargement of the heart, and pneumonia.
The algorithm is also able to convey some insight into its decision-making process by highlighting for each disease what particular part of the image it's looking at to make its decision.
One of the things that we've done is to leapfrog over a lot of the technical and infrastructure hurdles that we would be likely to encounter in any given system and put the algorithm in the power of the smartphone.
When I open the app, I can upload an image of an X-ray or snap a picture right on my phone, and then that image is sent to the cloud and then run through the ChexNext algorithm.
We have given this algorithm a very rigorous test, and we had 12 radiologists from around the country participate in this project, and we compared the performance of the algorithm against 9 of them.
The model performed comparably to the radiologists on metrics like accuracy, sensitivity, and specificity. The big difference in their performance was speed. The radiologist took around 4 hours on average to interpret the X-ray images. TextNext can interpret the X-ray images in less than 2 minutes.
Artificial intelligence and machine learning is in the process of transforming healthcare. But for this to work, we need AI specialists as well as medical specialists to work together.
If I were a doctor with a suspicion of a certain disease, I could get a confirmation from the algorithm. Or if I were a clinician who were using this app, the algorithm could direct my attention to something I may have earlier missed.
The ultimate vision, of course, is to have this in the hands of any clinician anywhere in the world who would like to use it. And to do that, we need to do some rigorous testing here at Stanford in a clinical trial format, and that's what we're doing now.
Here you can see that it's actually very interesting in terms of what the future lies for the use of AI. So you have to understand that AI is not to replace humans entirely, but it can actually do things much better than what a human can do in the interest, of course, of better healthcare service delivery. So you see now that AI can actually be utilized in order for us to improve our healthcare outcomes. And this is something very exciting because it will now be much faster for things where practitioners normally do well, but it's not necessarily needed, and they can focus on more complex skill sets where they are really valuable, especially in the ancient era where there is dearth of professionals in geographically isolated and disadvantaged area, and in a world where we are living in terms of volatility, uncertainty, and a lot of changes happening. Likewise, you can see that in the examples, there are many points of application, including that of the radiology-based or non-radiology-based. Aside from that, RxBox is one that is being utilized here in the Philippines for geographically isolated and disadvantaged areas to help us understand better assessment and diagnosing parts of our clients who are basically in the far-flung areas and we have to deal with them. This device is capable of capturing medical signals through the sensors that you can see on the screen and transmit them over the internet in order for the healthcare providers in that area to be able to consult with the medical specialists in the cities and provide them guidance in terms of interpretation as to the limited resources that they may have in the areas where they are actually located in. Likewise, you have to understand what nursing informatics practice is definitely in the current age. The most recent definition that's provided by ANA in 2014 is that nursing informatics is a specialty that integrates nursing science with multiple information management and analytical sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. Likewise, it supports nurses, consumers, patients, the interprofessional healthcare team, and other stakeholders in the decision-making in the roles and settings to achieve desired outcomes. So it is utilized through information structures, information processes, and information technology use. However, if you try to look at the definition, it somehow is blurred in terms of the practice of the rising profession. Well, it is there, but people are more interested than ever with data science, and there are actually many definitions coming with what data science really is. But for simplicity, let's take this example where we're seeing data science is actually the combination of programming skills, math plus statistics, and domain expertise. So given this, how do we delineate the practice of nursing informatics with that of a data scientist? Simply because there are a lot of similarities we're seeing right now in as far as definition of practice is concerned and the points of application in healthcare setting. Thus, we could probably run down in this flowchart in order for us to define our nursing informatics practice. So first, try to understand what you're doing or the task that you are being required that is is it something that actually requires nursing practice competencies and basic computer competencies and either information literacy or information management competencies? If you answer no to any of these three, then probably what you're doing is not an informatics nurse or informatics nurse specialist practice. If yes, then we have to check, of course, with the basic nursing informatics competency checklist as shown in the screen, and you can download the complete checklist through the reference provided. Hence, we ask again further questions. Does your task require analyzing healthcare information and communication technology strategies? If no, and you just focus on the prior skill sets that we talked about, then probably what you're doing is an informatics nurse with clinical or clinician practice or entry level. Then you can further check with the competencies if you say yes by looking into the other necessary skill sets. So here you can actually check with regards to the advanced nursing informatics competency checklist with the same link that was provided. And if you actually say yes further, or you would like to further evaluate if what you're doing leads to the design or requires you to lead rather the design, selection, and evaluation of healthcare ICT systems, then probably what you are doing is something else. But if no, then it may actually be an informatics nurse specialist with advanced practice in nursing at the master's level. And therefore, you would have to definitely check on this for the advanced requirements. If you are indeed working on leading the design, selection, and evaluation of healthcare ICT systems, what you are doing may actually be informatics nurse specialist with advanced practice in nursing that in the equivalencies require a doctorate level, and you can also check the competency checklist for these specific requirements. Overall, when you try to look at it, there are many qualifications framework already available and provided for you, and this is how the breakdown would be in as far as the PQF is concerned. Therefore, where do we actually see ourselves moving forward with all of these things that we have talked about? We have to establish the middle ground and understand why human nurses are actually irreplaceable. And some of this would include common sense, empathy, creativity, and ethical decision making. Things that AI and robots will probably have a hard time trying to be able to replicate, since these are very complex human emotions where we are actually not able to see right now anywhere in the future that AI can indeed replicate. We will also be seeing ourselves coexisting with many technologies, and one of the cases where it is already being used is in the operating room. So here we present to you a robotic nurse duty in the urology operative room case, and it is published in the link provided. So you can also access it at your own will. Recruitment of a new robotic nurse would need to undergo steps including sourcing, training, and apprenticeship. Here, we see that minimum requirements or qualifications needed would include 3 years work experience in the OR, including multi-specialty training in at least 2 departments that entails robotic surgery, commendable yearly reports, and, of course, favorable working habits. They would also need to undergo basic and training in terms of MIS-RC, entailing the Da Vinci surgical system, setting up, turning on, shutting down, connections, positioning of the robotic table and console, docking and undocking, malfunctioning, and errors management. It will last for 2 weeks for 4 hours a day, and of course, they will receive a training certificate at the end. Aside from that, they would have to undergo apprenticeship, and this would need being a second scrub nurse for 2 to 3 robotic procedures daily throughout this duration, an evaluation will be conducted, and a final recommendation by the robotic team will only then be carried out. Hence, when they pass all of this, they will become part of the team as an independent robotic nurse. And some of the images of this case would include this one, where they are actually able to perform their duties. There's also the robotic system style draping for you to appreciate, and some images with regards to the instrument check for robot-assisted radical prostatectomy. But it doesn't stop there. You can actually see a lot of career matrix. And clinical and health services domain is only one component of where health informatics actually can be seen through. So you can see there's actually the project management domain, there's an organization and behavioral management domain, analysis and evaluation domain, information management domain, and information technology domain. Thus, you can actually see somewhere other emerging fields of practice in terms of subspecialization in health informatics. And we will be talking about a role towards privacy officership, or one who specializes in privacy for healthcare as we go on with the next few slides. There are also many levels of expertise where professional practice can be categorized, and this is being left, of course, to different healthcare organizations or the national institution to decide how we will go about with this. Aside from that, we have the case of the data protection officer in healthcare facilities, as we have emerging use of teleconsultations through insecure platforms and applications requiring unnecessary information and access like contact tracing apps. And we have to understand that a lot of this has to be managed by somebody who understands well the practice of healthcare, and who better knows that? Of course, nurses who are at the side of the patient 24/7. So the case of the data protection officer would require, in the Philippine setting, complying with those frameworks provided by the National Privacy Commission. And it is also important to understand about the right to privacy. And this is something being protected as of other healthcare rights that we do advocate for our patients, as it involves potential cause of unwanted incident which can result to a harm or result in harm to a system or organization. Aspects of information privacy include that of the right not to have private information to be disclosed, and the right to live freely without surveillance and intrusion. Actors in the privacy setting in terms of many industries would include that of the personal information controller, the personal information processor, the data subjects, and the data protection officer. This talk in itself will be an entirely different and a complex one, so I'll just be passing through some of the terms here, but may not be able to elaborate on them due to the interest of time. Hence, types of information in privacy would include personal information and sensitive personal information. The key difference may include that of the name and photo of an individual in a social media network, photo and home address of an individual, and the name of an individual, the name of institution, and email address for personal information, and it can actually be any information that can ascertain one's identity. It can therefore be classified as personal information. Whereas a sensitive personal information may actually include information about an individual's health, education, genetics or sexual life, religious, philosophical, or political affiliation, government's issued ID and forms such as tax returns, and anything that is falling under Section 3T of RA 10173 of the Data Privacy Act of 2012. It is important also to understand that any information that needs to be utilized or handled by the organization has to fall under the context of lawful processing. And this is one where the data protection officer has to come into making people understand in the organization that it is supposedly lawful to process the information before you even start to collect them until the life cycle of data where you dispose them. I will not deal many of this information in detail due to the interest of time, but I would also like to highlight you being an advocate of your patients that rights of data subjects has to be upheld. And this includes the right to be informed, the right to access, the right to object, the right to erasure, the right to damages, the right to file a complaint, the right to rectify, and the right to data portability. Aside from that, you have to be very vigilant that in terms of acquiring information from your patients, you have to make sure that a privacy notice is indeed published or included in terms of information dissemination on how their data will actually be lawfully processed. And this includes the following section: service description, personal information to be collected, collection method, timing of collection, purpose of collected information, storage and transmission of personal information, method of use, location of personal information, third-party transfer, retention period, participation of data subject, and inquiry. And with all of this that we have talked about in this short talk, I hope that you are actually able to see further where you lie in terms of the profession. And I would like to leave you with this message, or challenge for that matter, that if you want to define big impact, I would want you to define your kind of nursing early on, because in the next decade, we will be seeing a very different landscape of a practice of nursing, and you will definitely be contributory to how you would like this practice and your own practice to be defined and perceived by many individuals. So stay inspired, stay innovative, and I would like you to come up and raise the bar of our practice of nursing in the near future. Any questions, feel free to drop me an email or check my links that is provided here, and I'd like to see you in the next talk.
Thank you so much, Sir Roderick Diab, for that very informative discussion. Sir, we just have a few questions for you. First, what are some interesting projects and results that you've seen recently during this COVID-19 pandemic?
With the onset of COVID-19 pandemic, the volume of medical waste has sharply increased. So this requires additional measures on waste management improvement in our hospital. Medical waste including disposable items such as your masks, your gloves, your face shield, should be properly handled and disposed immediately. This will prevent the spread of infection outside the hospital and decrease the infection cases among healthcare workers. And we've seen an opportunity to improve waste management in our hospital, particularly in infectious waste. The main goal of the project is to reduce the quantity of generated infectious waste by proper segregation, thereby reducing the monthly incurred costs associated with it. It aims to involve patients and healthcare workers' engagement in the pursuit of improving waste management. One of the observations we have seen is that patients are disposing their disposable food trays in the infectious waste bin, and that's an improper way of doing it. Plus, the bin gets filled easily. So we managed to change the waste bin with a smaller opening so that food trays does not fit into it. Plus, of course, several PDSAs like educating the staff and patient orientation before admission. And we have also used pictures to make visual instructions. You may have seen a lot of quality project, but a lot of quality project about waste. But what's interesting in this project is the involvement of the patient and the primary intervention. In quality, we have this low-hanging fruit concept, and these are the obvious or easy things that can be most readily done or dealt with in achieving success or making progress toward an objective. With after 1 year of the project, we have reduced the volume and cost of waste for up to 95%. So that's a lot of improvement for by merely changing the size of the bin.
Thank you so much, sir, for enlightening us. Another question. What are the possible impact of work stress or burnout among healthcare workers on the quality care services rendered to patients, especially this pandemic?
During an outbreak such as COVID-19, the entire population is subjected to increased stress levels that can have serious effects on mental health, especially in cases where mandatory isolation at home is imposed, and then workers can be affected by the psychosocial hazards arising from the present and future uncertainty of the work situation or from changes in work processes and arrangements. This can have a direct impact on the quality of work that the healthcare service provides, considering the decrease of manpower because of affected staffs or staffs who are affected of COVID-19, or just merely because of task burnout, or another reason is because of rapid and evolving changes in the care and treatment of COVID-19 patients. Now, let's not forget that besides burnout, the risk of transmission is higher for some staffs, in particular those in frontline response, or those who are providing essential services, or those who are working on highly concentrated workspaces. As witnessed, the quality of service may not be as parallel to pre-pandemic. There may be low patient satisfaction, and the number of complaints may be higher. To address this issue, risk control measures should be specifically adapted to the needs of these staffs, with an equal emphasis in psychological needs. In quality, we always want to learn and improve by having a comprehensive emergency preparedness plan in the workplace crafted to address health crises such as this pandemic. Workplaces may be better prepared to develop a quick, coordinated, and effective response while adapting the measures to the specific emergency situation.
Thank you for that, sir. And lastly, is there any scale that can be used in measuring compassion in nursing?
There are many scales that can be used in measuring compassion in nursing care, such as the compassionate scale, the compassionate care assessment tool, and the Schwartz Center Compassionate Care Scale, which is patient-reported instruments that measure the importance of healthcare provider compassion. The Compassion Practices Scale, which is also an instrument that measures organizational support for compassionate care. Compassion has not been universally described or understood, though is identified as a factor of nursing excellence. If compassionate care is routine in healthcare service models, nursing behaviors and attitudes that exemplify compassion must be without a difficulty identifiable to patients. However, a standardized scale measuring compassionate care attributes has been substantially absent.
As a nurse and a midwife, I am fascinated with the maternal nursing innovation and newest trends you excellently discussed. Thank you, Professor Kalida. My question is, with these impressive new technologies in OB, which one will you try to discover further and maybe pursue to apply or suggest to adopt in any institution?
Thanks for your question. From my point of view, if I say telehealth, telemedicine is the future. If you want to work on something or want to implement in your institute, we focus on telehealth, focus on telemedicine, because this is something that which will really improve the healthcare, which will improve the health system. the patients who cannot reach, who don't have easily access to the specialty to have the consultation. By this, it is easily for them. They can sit at their areas and they can have the consultation. So it's improving the healthcare system. If we see the patient benefit, it has more benefits to the patient side or to the antenatal care. If we say, example, if a female, she has a baby, she cannot come to the hospital for her antenatal checkup. By teleconferencing, she can just sit at home with the baby. Even she is not well, she will just call and get her consultation and get all the information. So this is the beneficial time saving for them. They don't need to come to the hospital, transport, sit in the hospital, wait for their time for the doctor to go to the to wait for their turn. So it is, if we say overall, it's very beneficial for all, from both healthcare side and from the patient side. It has a good outcome. Thank you.
For my second question, is telenursing still advisable in OB when this pandemic will be over? Can telenursing could possibly lead to higher cases of morbidity and mortality rate in maternal, fetal, or infants due to misdiagnosis that could happen in a virtual setting, which can be likely prevented during a face-to-face physical assessment?
Thanks for your question. We can say yes, still telemedicine, telehealth is the future, and even pandemic is over. There is no risks like you are saying about that misdiagnosis, but there is a model that is followed if there is antenatal care for by telehealth or telemedicine. Like in the beginning, there will be 1 or 2 visits by person. Third visit will be by telemedicine, by the video conference. Then the fourth will be by person. Fifth will be video conference, so on and so forth. There is a model for it, how to follow it by the telemedicine. If we go to the high-risk pregnancies, it's even beneficial for high-risk pregnancies. If a female, a woman is hypertensive, she has high BP during her pregnancy-induced hypertension. It will be beneficial. She will monitor and she will send it through the telehealth by the video or by the message that so it will be monitored more regular than coming to hospital and doing it. Same in blood sugar. If she has gestational diabetes, so blood sugar can be monitored at home, and same time it will reach to the doctor. So it is more convenient, more effective than to be a person coming and doing the test at home, checking the blood pressure at home. At home, the monitors are more regular, and it will come. The access to the doctor will be more easy. She don't have to wait for her appointment. She don't have to wait until the time comes when she need to go to hospital. Whenever she will do at home, she will inform the same time. She will message the doctor at the same time. So it is more effective, more beneficial than being a person in the hospital, present herself in the hospital.
Just several days ago, research results were released where COVID-19 was found to have a placental cost in gravid women and was linked to higher risk for premature birth. What do you think is the best way for nurses and midwives to educate pregnant women to get the vaccination?
Thanks for the question. COVID-19 and preterm, yes, some studies in US has shown that COVID-19 illness is really correlated with the preterm delivery. So how to motivate the pregnant ladies to get the vaccine? It is now, it depends on the program, the education that you will give them. You have to really when you teach them, when you give them education, again, the telemedicine, telehealth can work here. Once you have the teleconferencing, video conferencing with the patients, you can start giving them education, the benefits of vaccine on the woman and on the infants, the risks that if they will not take the vaccine, that there are going to higher chances of preterm birth, because you have to explain to them that during pregnancy their immunity is very low, there are higher chances of getting infected, so and it's more more dangerous to the baby's health, infant health. So you have to motivate them by showing the evidence based practices, evidence research and all the studies that has proven by that. For sure they are getting motivated. That's what here we gave the pregnant ladies. They came by themselves after they were informed, they were given the information all related to the risk that if they will not take the vaccine, they came by themselves. They are the one who came that they are pregnant and then they want to take the vaccine. I think this is our role to inform, to guide them in the proper way to have the healthy infant, and the health woman's health will be secure. Thank you.
First question. What research direction would you recommend to nursing students in order to enhance nursing informatics, and why?
Student nurses can actually focus on a lot of things in terms of improving nursing research in the area of nursing informatics. Student nurses can start by looking into competencies that I presented earlier, in as far as how far already are the level 6, level 7, and level 8 competencies amongst professionals in the workplace. There are also many areas of interest in terms of data analytics and the use of data in terms of meaningful use of healthcare outcomes, aided with the use of technology and other related studies. Systematic reviews or scoping reviews can actually also be points of areas where student nurses start looking into the relevance of what is available in terms of nursing informatics studies in the Philippine setting and in other countries applicable to the Philippine setting.
Second question. How best can you deal with cybersecurity issues on Zoom and other platforms during nursing education?
Protecting confidentiality basically emanates from the element of designing where will you be putting the data. Only this time it is an online method. So making sure that you use and select a secure protocol or a secure application or a secure platform is essential. You don't use applications or platforms that basically do not have a lot of controls like two-factor authentications or breach management or access management. You also have to make sure that you try to separate personal indicators or do not even collect it to begin with if they are not meaningfully being used in your studies. Therefore, careful design of what you collect and what you do not need to collect from your respondents is the core element of trying to protect already confidentiality at the very onset. And of course, data sets that do not mean anything even if taken by perpetrators or threat actors would not be meaningful and useful for them.
Third question. How can you best protect confidentiality issues in nursing research using online-based recruitment of respondents?
Protecting confidentiality basically emanates from the element of designing where will you be putting the data. Only this time it is an online method. So making sure that you use and select a secure protocol or a secure application or a secure platform is essential. You don't use applications or platforms that basically do not have a lot of controls like two-factor authentications or breach management or access management. You also have to make sure that you try to separate personal indicators or do not even collect it to begin with if they are not meaningfully being used in your studies. Therefore, careful design of what you collect and what you do not need to collect from your respondents is the core element of trying to protect already confidentiality at the very onset. And of course, data sets that do not mean anything even if taken by perpetrators or threat actors would not be meaningful and useful for them.
We would like to thank our speakers for answering all the questions and really sharing your field of expertise to all our participants of this webinar. Let us move on to our live quiz. By the way, the person who will answer correctly will be able to get exciting prizes from Aim to the Top Review Center.
Get ready your gadget as we start the live quiz. So reminders, as you join the platform, please use your full name. And until the end of this program, please do join us since we have exciting prizes and raffle at the end. There will be two participants that will win IELTS and NCLEX, free IELTS and NCLEX from the Aim to Top Review and Training Center. Reminders, you are given as we wait, you are given 20 seconds to answer each question. And we also would like to thank all the participants who joined today's webinar. Around 100 participants joined the webinar, and to all the participants who joined us live at the PWU FB Live page, thank you for joining our live for today. So just a reminder for everyone, there will be 3 winners. The third placer will get 200 pesos, the second placer would get 300 pesos, and the first placer will get 500 pesos via GCash. Let me clear this one. You will win free NCLEX or IELTS review at the end of this webinar. We will choose via will. Reminders once again, as we wait for the quiz, is please use a valid email address as you do the post-evaluation form. We would also like to thank our sponsors, the Mother and Child Nurses Association of the Philippines Incorporated and Aim to Top Review and Training Center for sponsoring all the quizzes, the prizes for the quiz and raffle. Also, leaderboard will be flashed at the end of each quiz for the top 3 winners who answers correct and the fastest to submit their answers. I hope all the participants are ready as we flash the QR code. And also a reminder for everyone is that those who was able to do the post-evaluation form will get the e-certificates. Let's just wait for the QR code. Also, a link will be posted at the comment section for our live viewers. Okay, QR code is already flashed on your screen. We will be start. The first question would be, "10 seconds left. 5, 4, 3, 2, 1. And the correct answer is 13% of the participants got it correct. For the next question, "5, 4, 3, 2, 1. Time's up. And the correct answer is 36% of the participants got it right. For the last question, you have 4 choices for this one. Please key in your answer and you have 10 seconds left. In 5, 4, 3, 2, 1. Time's up. And the correct answer is... And 34% of the participants got it right. Congratulations, everyone. So this is the top 3 who got it correct and the fastest to submit their answer. Please do comment your names on the comment section at the PWU Live FB Live page. Thank you everyone for participating in our live quiz. We hope that you enjoy and we will reach out to you for your prizes. Thank you so much to those who participated in our live quiz. At this juncture, we will now be awarding certificates to our resource speaker for sharing their time and expertise. Philippine Women's University Graduate School of Nursing Certificate of Appreciation is hereby granted to Roderick B. Dayag for sharing his outstanding knowledge and valued expertise in nursing webinar series Catching Up in Nursing Issues and Trends, Leveraging Quality Improvement During the COVID-19 Pandemic. Given this 26th of February 2022, PWU Graduate School of Nursing Certificate of Appreciation is hereby granted to Kalida Bano for sharing her outstanding knowledge and valued expertise in nursing webinar series, Catching Up in Nursing Issues and Trends, Improving Maternal Nursing Through the Current Updates and Innovation. Given this 26th of February 2022, PWU Graduate School of Nursing Certificate of Appreciation is hereby granted to Dr. John Francis L. Fausterillo
for sharing his outstanding knowledge and valued expertise in nursing webinar series, Catching Up in Nursing Issues and Trends, Nursing Informatics in the Era of Physical Distancing, given the 26th of February 2022, PWU Graduate School of Nursing. And for the hardworking people behind this webinar, let me give recognition to them. Certificate of recognition is hereby granted to Heidi S. Bacani for her remarkable contribution as the webinar chairperson in the Nursing Webinar Series, Catching Up in Nursing Issues and Trends. Certificate of recognition is hereby granted to Remelin F. Inso for her remarkable contribution for registration and evaluation in the Nursing Webinar Series, Catching Up in Nursing Issues and Trends. Certificate of recognition is hereby granted to Gail F. Galang for his remarkable contribution as part of the Certificate Distribution Committee in the Nursing Webinar Series, Catching Up in Nursing Issues and Trends. Certificate of recognition is hereby granted to Sarah May N. Crack for her remarkable contribution as part of the Certificate Distribution Committee in the Nursing Webinar Series, Catching Up in Nursing Issues and Trends. Certificate of recognition is hereby granted to Mark Anthony Akak for his remarkable contribution as part of the Certificate Distribution Committee in the Nursing Webinar Series, Catching Up in Nursing. Certificate of recognition is hereby granted to yours truly, Maria Joan C. Ocampo, for her remarkable contribution as the Media and Communications Coordinator in the Nursing Webinar Series, Catching Up on Nursing Issues and Trends, signed by the webinar chairperson, Heidi S. Bacani, webinar consultant, Dr. Mark Santos, and Dean of the School of Nursing, Dr. Minerva B. De Ala. Okay, this is the evaluation form. So please do scan the QR code, flash on your screen, and reminders all the participants that was able to accomplish this form will be included in the grand raffle. But then again, after ending the webinar, other participants can still answer this one. At this moment, we would like to thank our sponsors for the webinar event.
Breastfeeding protects the mother and child, and its health benefits are evidence-based and irrefutable. According to the World Health Organization, breastfeeding is and should be the normal way of providing young infants with the nutrients they need for optimal development. Virtually all mothers can do breastfeeding for as long as they have accurate information, utmost support from their family, the healthcare system, and even the society at large. Amidst the global crisis, with the present milieu of our country, and other possible circumstances that we might encounter, the Mother and Child Nurses Association of the Philippines, MCNAP, continue to serve as a luminaire, taking lead in achieving the breastfeeding best practices, women empowerment, in sustaining the gold standard. True enough, breastfeeding remains to be the clinical gold standard for infant feeding and nutrition, with breast milk uniquely tailored to meet the healthy needs of the growing baby. The breastfeeding best practices are key components to maternal and child quality and patient safety. Moreover, breastfeeding is a gift of life, an act of women empowerment that essentially lasts a lifetime.
First set is NP1 that will focus on CHN. Can you follow? Tama ba? CHN ba? Okay, NP2 is Umipedia. NP3 is MS. NP4 is MS. NP5 is Psychia. NP3, hindi ko gusto magkumpiyansa mo. Okay, usually pag NP3, dalikod yung kuman. Okay? Here, your pencil. Ball pen, read instruction, identify if it's set A or set B. Kinahanglan i-read ninyo kung ang sequence number is 0036, dapat i-get into 0037 or na-sequence na pattern. Now remember this one, you need to relax, no? Kung lisod si NP1 ay kabalaka ng NP2. Kung lisod si NP2 ay kabalaka ng NP3. Kung lisod si NP na NP4. Kung lisod si NP1 ay NP5. Kung lisod si NP5, pag-pray.
At this moment, we'd like to thank our sponsors for this webinar event. To our sponsor, Mother and Child Nurses Association of the Philippines Incorporated. We care, we deliver. A member of Asia Pacific Nurses Association, please visit their Facebook page, MCNAP Official, and they are located at 1663 Benitez Street, Malate, Manila. You may process your membership by scanning the QR code flash on your screen. Please scan the QR code for further information. And to our major sponsor, Aim to Top Review and Training Center, the true leader of excellence. They are located at the second floor, Corrales Extension, Barangay 22, Cagayan de Oro City. You can also visit their Facebook page, Aim to Top, with contact number of 0917-102-0511, or send them an email at attrx30@gmail.com, all small letters. Please scan the QR code for further information. At this juncture, we will be having the most exciting part, a raffle courtesy of our sponsor, Aim to Top Review and Training Center will be giving away a free NCLEX and IELTS review, and we will use the wheel to choose our 2 lucky participants for today.
So reminders, only participants who was able to accomplish the evaluation form will be included in the raffle. Make sure that your email address is valid so that you can also receive your e-certificate after. While waiting, we would like to thank all the participants who joined on today's webinar. We hope that you was able to have an additional knowledge you was able to have an additional info regarding a certain field of nursing and midwifery. And we're looking forward to see you in the next webinar series, in the next webinar series in the Catching Up on Nursing Issues and Trends. Let's just wait for the wheel as we pick the 2 lucky winners for today. And just a reminder, let me clear, we will be given away a NCLEX or IELTS review and not for the processing. Only a review from the Aim to Top Review and Training Center. So we'd like to thank again our sponsors, Mother and Child Nurses Association of the Philippines and Aim to Top Nursing, Aim to Top Review and Training Center. So let's just wait for the wheel to be shown on your screen. Once again, reminders, certificate will be sent to the attendees within 15 working days, and only those who registered and attended in the PWU official FB Live will be issued an e-certificate. Attendees' request for evaluation form on the PWU official page and email after the webinar will not be entertained. Also, PRC forms and program ID will be attached to the certificate, which the attendees may apply for CPD units under the Self-Directed Learning application. PRC, okay, the wheel is now on your screen. Okay, are you guys ready for the raffle? So we will be choosing 2 lucky participants for today. Congratulations, Micah Rose, Margaret M. Mutya. I think I'm familiar with the person. So, congratulations. Please do comment on the comment sections, and we will reach out to you for your prize. Thank you once again, and congratulations, Micah Rose, Margaret Mutya. What a lucky day for you, Miss Mutya. So for the next, let's choose the next winner. Who would be the chosen one once again? Thank you to all the nurses and midwives. Okay, the winner is Eunice S. Matosa, RN. So congratulations, Miss Eunice Matosa. Please do comment on the PWU official live page so that we can reach out to you regarding your prizes. So I hope you are happy as our sponsor was able to provide or to give us 2 free NCLEX or IELTS review. And thank you everyone for participating and answering and being active on the social media. So thank you everyone. So once again, the 2 winners are Miss Mutya and Miss Matosa.
Thank you everyone, and this concludes the webinar, Catching Up in Nursing Issues and Trends. Let us all congratulate the Graduate School of Nursing students of Masters of Arts in Nursing for a job well done. Spearheaded by our hardworking chairperson, Ms. Heidi S. Bacani, our supportive professor, Dr. Mark D. Santos, and our ever-supportive Dean Minerva V. De Ala. Also to our technical support for assisting in making sure that this program is possible. Thank you for participating, and I'm Maria Joanne C. Ocampo, your host for today, and let us all be safe and healthy. God bless everyone and enjoy the rest of the weekend.